The 3MDG Fund supports 34 townships in 2 special regions to deliver quality essential maternal, neonatal and child health services to the entire township.
The 3MDG Fund is a major pooled fund for health in Myanmar. It brings together the resources of 7 donors, in total over $250 million, with the purpose of addressing the major health challenges that Myanmar faces. The goal of the fund is to bring down maternal mortality, child mortality, and address the burden of communicable disease in Myanmar, TB, malaria and HIV.
DG's health system strengthening component invest in national health systems so that they become stronger, they become more resilient, more responsive, so that regardless of what disease or what impact it has, it will be able to respond better for the needs of the population. And the way we do that is that we invest mainly in the service delivery system, make that stronger, as well as the financing systems.
The first major challenge that the fund faces: how should we use substantial amount of funds, but not endless funds, to address priority needs of people in Myanmar? Good project planning and good formulation of a wide program, taking into account context analysis, needs assessments, was critical for this. One of the second major challenges that the fund faced in 2015 was how to use its resources to respond to the needs of people who were affected by catastrophic floods. How can we use the assets and the capacity of a development fund to respond to urgent health needs, urgent water sanitation needs, and broader needs across many parts of the country where the fund had a presence through its partners. The third major challenge of the fund is how to scale up healthcare in conflict-affected areas. This does require substantial focus. It requires continual analysis. It requires regular missions and regular monitoring to ensure that what we're doing is being delivered in the right way.
The 3MDG has very rapidly responded to the massive floods that affected the countries in August of that year. Very quickly, the fund director, with the support of the fund board, has decided to provide assistance to the township health authorities and the population they were serving in this time of crisis. To do that, the fund has demonstrated flexibility by allowing its implementing partners to reallocate staff and resources, financial resources, to launch an immediate assessment of the need in support of the township authorities, as well as to launch an emergency response to address the immediate survival needs of the population in the areas traditionally covered by the 3MDG Fund.
I think one of the main reasons the fund has been so successful is our rights-based approach to health. So one of the big things we've been working on is to build the capacity of our partners around 4 main principles: responsibility, fairness, inclusion, and do no harm. And the main aim of this is to increase access to healthcare for all people in Myanmar, in particular for the vulnerable groups such as women and ethnic minorities and other marginalised peoples.
During 2015, we were able to contribute 10% population coverage for maternal newborn child health services across Myanmar, scaling up access to healthcare for about 4.5 million people. Aside from this, the fund has made very substantial contributions to how many people are able to access timely malaria treatment. For example, 2 million people, predominantly in areas of the country where malaria drug resistance is a most pressing concern, have been able to access timely treatment through the fund. The fund has had a major contribution towards harm reduction targets in the country. Almost 40% of target achievement in 2015 was the contribution of the fund. The major other area of the fund is contributing to a better health system, working in partnership with the government to put in place more sustainable approach to health system outcome, and there the work that we do is around improving infrastructure. 2015 saw a major program of clinic construction in Magwe region in the western part of the country, saw a major effort to improve the supply chain across Myanmar, and also really good results in the program that we have, which supports every midwifery school in the country, which improves the quality of training, the quality of in-service training, and therefore ultimately the quality of health outcomes.
We have a performance management framework which is based on UNOP's project management and risk management principle. We just took it a little bit further to be able to implement it in our healthcare setting and to fit the context here. What the tool might do is it might provide guidelines on how we can risk manage actively, and the program staff can go into the field and observe how service is being delivered to the patient in the villages using guidelines such as RSQAs, which is rapid service quality assessment tools.
So in terms of our health system strengthening investments, it's a very new field, it's a new concept, and so engaging with the government was one of the key ways that we could program our investments. And what we learned was that in order for any project to be successful, you really need high-level political and Ministry of Health commitment to it. And more so than that, you need ownership.
I'm very proud of 3MDG Fund because it's the biggest ever fund for maternal, newborn and child health in Myanmar, and it's working in very remote area and hard to reach area and conflict area where nobody wants to work. During my job responsibility, I have to travel a lot, and then I can directly hear and see myself the differences we are making in the community.
The thing that I'm most proud of is our direct funding for civil society organisations called Collective Voices. This funding has provided money for organisations to explore and address the social determinants of health in Myanmar. The organisations have conducted over 500 community meetings, listening to the voices of the people about about the barriers that they experience in accessing healthcare.
And another really key thing that we've supported is capacity building of the Ministry of Health. The main way that we've been doing it is by providing scholarships to Ministry of Health staff. And let me just tell you that this is probably one of the best value for money investments we have made. Because we have seen them come back to Ministry of Health, go back to their previous positions and have made real impact. We can see they are more empowered, more confident with the skills and knowledge they've learned. One of them actually drafted the reproductive, maternal and newborn adolescent child health strategy for the country. Another student who came back actually helped with all the coordinating and actually conducting the township health plan training nationwide again.
This year, we successfully launched the nationwide media campaign, mainly to raise the awareness among the community for the TB and the drug-resistant TB. This drug-resistant TB is very tricky, and it needs to take the treatment for 20 months, so which is the big challenge for the the public health professional, and patient really need to adhere to the treatment for two of the treatment goals.
We introduced a new innovative system called electronic cash transfer system. So the patients are receiving support without any delay throughout their treatment, which significantly contribute the patient's adherence on the treatment as well as contribute to the program outcome.